Ovarian cancer is a serious health concern for women worldwide. It affects the ovaries, which are part of the female reproductive system. This type of cancer is often called a silent killer. This is because its symptoms are often vague and easily mistaken for other less serious conditions. Early detection of ovarian cancer is crucial for successful treatment. However, it can be difficult to diagnose in its early stages. This is because the symptoms are often non-specific. These symptoms can include bloating, abdominal pain, and changes in bowel habits. Unfortunately, many women are diagnosed with ovarian cancer at a later stage. This is when the cancer has already spread, and treatment becomes more challenging. The 5-year survival rate for ovarian cancer is lower than many other types of cancer. This highlights the urgent need for greater awareness and understanding of this disease. It is important for women to be aware of the risk factors, symptoms, and available screening options for ovarian cancer. Early detection saves lives, and knowledge is power when it comes to combating this disease. Several factors can increase a woman's risk of developing ovarian cancer. Age is a significant risk factor, with women over the age of 50 being most vulnerable. Family history also plays a crucial role. Women with a close relative, such as a mother, sister, or daughter, who has had ovarian cancer are at an elevated risk. Genetic mutations, particularly in the BRCA1 and BRCA2 genes, are strongly associated with an increased likelihood of developing the disease. Other risk factors include a history of endometriosis, obesity, and prolonged use of hormone replacement therapy. It's important to note that having one or more of these risk factors doesn't guarantee that a woman will develop ovarian cancer. It simply means that her chances are higher than those without these risk factors. Women who are concerned about their risk should consult with their healthcare provider. They can discuss their individual risk factors and determine if any preventative measures or screenings are necessary. Treatment for ovarian cancer typically involves a multidisciplinary approach tailored to the individual patient. Surgery is often the first line of treatment, aiming to remove as much of the cancerous tissue as possible. The type of surgery performed depends on the stage and spread of the cancer. Chemotherapy, using powerful drugs to kill cancer cells, is another common treatment modality. It can be administered intravenously or directly into the abdomen. In recent years, targeted therapy has emerged as a promising option for treating ovarian cancer. Targeted therapies work by identifying and attacking specific molecules involved in cancer cell growth and survival. These therapies may have fewer side effects compared to traditional chemotherapy. The choice of treatment depends on various factors, including the stage of cancer, the patient's overall health, and their preferences. While there's no guaranteed way to prevent ovarian cancer, certain lifestyle modifications may help reduce the risk. Maintaining a healthy weight through regular exercise and a balanced diet is crucial. Women should also limit their alcohol consumption and avoid smoking. Regular pelvic exams are essential for women's health, but they don't reliably detect ovarian cancer in its early stages. Genetic testing may be recommended for women with a strong family history of ovarian cancer. This testing can identify mutations in genes associated with an increased risk of the disease. Early detection is key to improving outcomes for ovarian cancer. Women should be aware of their bodies and report any unusual symptoms to their doctor promptly. By understanding the risk factors, being proactive about their health, and seeking medical advice when needed, women can take charge of their well-being and potentially save their lives.